Good afternoon, I'm Mabel Jong, and you've joined us in the World Healthcare Congress interview zone. Also here with me today is JoAnne Anderson. She is EVP of Healthcare at Teleperformance. Hi there, how are you?
I'm great, how are you?
Fantastic. JoAnne, I'd like to ask you about the exchanges first off. We already know a lot of information now that the exchanges are online, people have gone on, enrolled. The health plans are going to evaluate how it all went down. What are your predictions on what they're going to be doing in 2015 and then the couple of years following that?
Okay, so first of all, the exchanges, no one really knew what was going to happen to call volume or web volume, and we all know it was exceeding expectations. There were some issues with the website, so then they called, and I think, you know, all in all, the exchanges went very well. Mm-hmm. And I think what we've learned from that is there are a large population of people that were uninsured and now have insurance. So I think it's the beginning of the evolution. And I predict that the plans are going to start doing outbound calling and find out, okay, let's explain the plans to you so that they understand the benefits, because it's not well known that they have to pay premiums, what the benefits are, what the rewards are if they stay healthy, and so on. So I think it's going to be an evolution now of education and then adoption of the plans. And I think then as they start looking at the plans costs in 2015, they're going to look at what worked, what didn't work, which plans did we make money on, which plans did the members decide to stay with, because in year two, they can always re-elect to go to a different plan or a different provider.
So what's going to make the difference?
I think it's a combination of the cost for the value. And if they are educated about the benefits and understand the value they're getting from the benefits, then they're more than likely going to re-enroll in the plan and understand the premium, the benefit they're getting from the premium.
When we talk about improving consumer experience, what is that referring to specifically?
So to me, consumer experience, being at Teleperformance, we do business all over the world with about 25% of the world's population, and we look at every consumer individually, and it depends on the specific need that they have at that specific time. And so I don't think one size fits all when it comes to a consumer. And they may have a certain time in their life, a health incident or something happens to their family that will turn into a specific need, and the better we can take and help them meet that need in healthcare, the more apt they will be to have a positive experience rather than a negative experience.
How much of your advice is really key to how health plans go about doing their business, or do they already have pretty set ideas and policies in place that encourages a certain way of doing things?
No, I think Teleperformance, because we do business with a lot of the health plans, we can aggregate a lot of the data, whether it's in a consumer survey or they have, we look at the usage of their web or we look at the tweets that they have. We aggregate that data and can send back to them, what does the consumer say? What do they like? What do they not like? And start to mold either different benefit plans, better education, and better utilization of the plan. So I think we play a big role in understanding what the consumer is thinking.
And does it even go to the nuances of how old the consumer is? You know, the experience you may adjust because the person on the phone or on the web is 23 versus someone who's 53.
Absolutely. So a big push on the exchanges was to have those 26-year-olds join the plan.
Okay.
And most 26-year-olds don't think they need a plan because they think they're healthy. Well, if they have that catastrophic failure, they could go bankrupt. And so it's that education of why you would need the plan and what's the best plan for that person that's 26 versus maybe someone that's looking at the exchange from a Medicare perspective over 65, which may be looking at it from a whole different perspective. Most of our seniors have 3 chronic diseases that are going to be far more expensive. So as a health plan, you're going to look at how can we get them engaged so that they can do more prevention rather than treatment.
Okay.
So I think it's, again, one size does not fit all.
You're very knowledgeable about rating scores. Why should these matter to the average person?
Well, let me take it from a perspective. So rating scores to me are many different things, but the federal government owns about 40% of the healthcare plans between Medicare and Medicaid, and now with the exchanges. And they have what's called the star ratings. And so for a plan, it's based on the customer satisfaction, it's based on their health outcome scores, it's based on whether they treated that member well or not, whether the doctor treated them well or not. And so it's all based towards quality. And so if you do a better job with quality and your customer rates you higher, and that's perception, they get more reimbursements. If they get more reimbursements, they can have better and richer plans. Therefore, they'll retain those customers for a longer piece of time. And the goal in a health plan is to have them from the time they're 26 through maturity all the way up, so a member for life, basically.
What are some of the things that you advise plans do to make sure that those ratings are strong?
Well, I think the ratings are about customer service, they're about health outcomes, and they're about treatment capabilities. And so using the data that Teleperformance collects, again, it's an evolution. The first is to really identify the preferences of the member. So do they prefer you to call them on your cell phone? Do they prefer you call them at night because they're working? So if you understand the preferences, you're going to get them at the right time when maybe they have time to listen to the plan benefits. If they understand the plan benefits, they're going to be happier when they pay that premium. If for some reason they do have something that goes wrong, if they get the right treatment and then go into prevention, that's good for the health plans, because then healthier people spend less money in the health plan process and everybody wins. So I think it's sharing that information from the personal basis to actually putting some of the clinical data into the system. So when I call in, I may go, oh, I see you haven't had your flu shot. Should I set that appointment up for you? Oh, I see you haven't refilled your medication. Did you know that you can do mail order and get 90 days worth of medication instead of 30 for the price? Why don't I put that order through for you today? That's what consumerism is anticipate and help someone, not make them do the work themselves.
Okay. JoAnne, well, thank you. I know you just presented on a panel. What are some key takeaways you think that people ought to take back with them?
I think the number one takeaway is I'm a consumer, and I think like a consumer, and I think healthcare hasn't always thought about the consumer first when they are a consumer. They think about consumerism when they shop online or when they buy a new car. When they're spending 20% of their income on healthcare, think of it as consumerism, and what would you do if it was you? And I think that's the biggest takeaway that we can take, and it's going to take time.
Thank you so much, JoAnne.
Thank you.
A pleasure to meet you. And I'm Mabel Jung. Thanks for watching.